Population aging is a fundamental problem for all European countries. Bulgaria ranks 5th in the world in terms of share of older people. Pretty often, these older people are left alone. They need care and warm human approach. The project Home Care Towards Independent and Dignified Life is implemented by the Bulgarian Red Cross, together with the Ministry of Labour and Social Policy, the Ministry of Health and the Swiss Red Cross, and is supported by the Swiss government. The main objective within this project is to create a model of integrated social and health home services for people older than 65 years. There are lonely people who need care. There are old people whose families are temporarily out of money. Just for those people, a project for home care will help. The family is relieved. People stay at their homes instead of going to hospitals, and they still get high-quality service. Besides, those involved in delivering support at people's homes get a job. My husband died. My child died too. I'm alone. They started to visit me every week on Wednesday. Here's what they do for me during the visits to my place. This home care center of the Bulgarian Red Cross was founded with the support of the Swiss Red Cross. The center provides care for lonely older people and people with disabilities and supports them in their everyday life. Before accepting a new beneficiary in our home care center, we contact his general practitioner and make a health and social inquiry to get his history of diseases and the general practitioner's prescriptions. On that basis, the manager of the home care center, together with a physician, assesses his condition. Through the activities that we provide, we aim at complex satisfying of the beneficiary's needs. The home care team examines and listens attentively to our needs. They get us medicines and take care of other necessities as well. I'm happy, even more than happy. Every day I have to take emotionally personal confessions of many older people who unfortunately ask to get into older people's homes. They want to get there just because they feel lonely. They need support, while at the same time they are dignified people who would never like to depend on their children. With this project, we aim at establishing financial standards. By the end of the project, we shall be able to estimate both the medical and the social activities within the service. These financial standards will help the government to provide financing and sustainability of home care services after the end of the project. In economic aspect, we always try to achieve more health services for less money. Care at home is cheaper than in hospital. This is an obvious economic effect. Wraca is not only the poorest region in Europe, but it's also exposed to a huge demographic problem. There are many older people, while many young people have left the country, so the care for their parents is left to the medical and social institutions. Within the project, a research about the specific needs, as well as the attitude of the Roma population towards home care services will be performed. It will be explored whether the respondents would use this service and whether they would provide home care themselves. Local people will try themselves how the system works, and they will decide whether it is good for them. I expect that the answer will be yes. And if it is yes, Bulgaria will have to state that this is a good instrument for healthcare and assistance for chronically ill and old people. We will actively support this project and we are committed to it on behalf of the Bulgarian Parliament. We, as an organization, will cooperate in all possible ways for the success of this project, as we are concerned about the results. Our grandmothers and grandfathers need our support, and I believe that all together with the government and the non-governmental organizations, together with the private sector, we'll manage to accomplish this program so that our older parents and grandparents could rely on us for their dignified old age.